Hi, I'm Yildi from Neurocentric Health and Fitness. If you have ever dealt with any back pain or hip pain or knee pain, you want to watch this video. We're going to learn an exercise that will help to relieve that pain. I call it the zigzag. So you're going to bring your legs one in front, one behind you. Let's bring the right leg in front of you and the left leg behind you. You sit mostly on your right sit bone and make sure that the right heel is not in your groins. Your right shin is further away from you. And then you take your left leg all the way back, try and get your left thigh parallel to your right shin. Make sure that your left heel is not close to your buttocks. You see how I'm leaning forward? Is saying that this left hip is a little too tight. If you have any knee pain with that, a couple of options you could do. You could bring the leg forward, or you could place something under your right buttocks and it will level the hips and it will change your whole posture. First movement, we'll do a couple of movements in here. First movement is find your pelvis and tilt your pelvis forward and backwards. Imagine that your pelvis is a bucket of water, and when you tilt it forward, you spill the water forward. When you tilt the pelvis backwards, you spill the water backwards. And just by doing that, forward tilt, backward tilt, it will open up the hip socket, the hip joint itself. Couple of more repetitions. Try not to squeeze your buttocks. And then maybe you could get rid of that prop, and then your seated position is already better. Let's make this even more efficient. Anchor your left knee, look at your right heel, and try to lift the right foot off the floor. Now if that is not lifting, meaning this internal rotation is not working, so you find your left hand, you grab the leggings or whatever you're wearing, and you helping that leg to come off the floor. So this is supported, assisted internal rotation. Do a couple of those, and then see if your brain learns something and the leg could come off the floor. When the hip is not open, you will get a couple of muscle cramps, so go a little slower. We'll have one more thing to do. Straighten the left leg on this side, because obviously we'll be doing the other side. Straighten the leg next to you. Point the toes and reach the toes, reach the ankle away from the hip. Notice how that feels. Notice how your left sit bone is off the floor. Can you reach that heel further away? And then the same way as we rotated the leg, we're going to rotate the leg and we're going to tilt the pelvis forward. Remember that anterior tilt we did? Spill the water forward, spill the water back, let the leg rotate. Keep the toes pointing like a ballerina. Is a slow opener through the hip joint. It will open up your hip, your sacroiliac joint, your low back. Very simple. And then swing the legs around. Let's do both of those on the other side. So start out with the zigzag. Left leg in front of you, right leg behind you. Remember, the right leg goes far back enough so you can have the right thigh and the left shin parallel. Tightness in the right hip will ask you to prop up. A blanket, a pillow, a cushion will do. You don't need to have a yoga blanket for this. First movement is with the pelvis. Remember, pelvis is a bucket of water. You spill in the water forward with an anterior tilt. You spill in the water backwards. You do want to feel that movement coming from the pelvis. Do that a few times. Notice when you tilt the pelvis forward, the low back is arching, that's fine. When you tilt the pelvis back, the back is rounding. And then once you did it a few times, you scoot off that blanket. Now let's see if that is a little more comfortable. Maybe this time we can work on the internal rotation just as we did on the other side. Look at your foot and see if you can lift the foot. It's not going too well. So I'm going to reach back, grab the ankle or grab the thighs and lift that foot up. The foot is lifted and the shin is lifting, but the movement is coming from that internal rotation. So now let's see, it can do it itself. It's all good. The brain learns through different steps. Sometimes we need a little passive work, sometimes we need a little active work. And then you straighten your legs out to the side. Obviously my studio is not big enough for me. Point the toes, open up the ankles. Same thing, we're looking for that internal rotation. The pelvis tilts forward, the leg comes with it, and then you tilt the pelvis backwards and you externally rotate and you're almost sitting down onto your booty. And if the hips are tight, you're going to see this knee popping up. So you can keep that down with your other hand. Roll it in again, and then roll it back. And the second time, the knee stayed down because the hip opened up. Do that one more time, just for having 3 good repetitions. And then take it all the way back. Bring the legs around and take a little breather. If you want to know some more tricks how to open up the hips and relieve the stress from your low back, just check the videos in the link below, and don't forget to subscribe to my channel where you can get more tips. Thanks for watching, see you soon.